Hey guys, my name is Grace Rowe and thank you so much for joining us for another information video about COVID-19. In today's video, the New South Wales Chief Medical Officer, Dr Kerry Chant, will be answering questions that have been put forward by young people in New South Wales. Thank you so much, Dr Chant, for joining us today.
Oh, it's my pleasure.
So to start off this interview, I'd love to ask you about testing. Could you tell us what would warrant getting a test?
So any COVID symptoms would warrant a test, and we really understand that it's an imposition sometimes and you're going to think those symptoms will resolve, but we want people to come forward for testing as soon as those symptoms develop and not wait a few days for those symptoms to linger. The sorts of symptoms we're looking at is a runny nose, cough, fever, but also can be loss of taste and smell. Some people can have muscle aches and pains and headaches. So having a low threshold for engaging in testing will really help us identify cases quickly and block those trains of transmission.
And under what circumstances would we get retested for COVID-19?
So in responding to cases, what we've often learned is the value of early testing. And that often involves us gaining a bit of extra time on the virus. And so if we know there's been someone with COVID in a particular setting where we think other people may have been infected, we might ask you to get tested even if you don't have symptoms. And then what we might be asking you to do is stay in isolation for 14 days after that exposure, and then potentially even get tested at the end of the 14-day period around that day 10. Because the symptoms can be so mild, particularly in younger people, we've found that those techniques help us pick up cases. So it's not that young people are dismissing their symptoms, it's just that a bit of a mild runny nose or a bit of a headache, the young person or an older person for that matter may not really describe that as being unwell or sick. So some of our messaging is around, if you've been in these certain environments, please get tested immediately, still isolate yourself, and then get a repeat test towards the end.
And Dr Chant, we know that socialising is important, but given the current circumstances, we also need to be mindful of our health. As we move towards summer and we want to hang out with our friends more, how can we socialise safely?
So the first is stick to those 4 basic messages. So if you're feeling sick at all, don't push yourself, stay home, isolate, get a test. So that's probably the main message. The next one is when you're out and about, just think about the sorts of environments you're in, how you can maintain that social distancing whenever you can. Now, it's not always practical, but if you're going to be in environments where you're bunched together, then wearing masks can also help you. And certainly just good hand hygiene, so that basic thing of washing your hands frequently. So just those basic public health prevention measures are just going to have to be sustained for the long haul until we've got a way out of this, a totally effective treatment or a vaccine. We're just going to have to learn how to live with COVID and just sustain those behaviours and make them more normal, that we practice routinely.
And is it important that young people don't visit more than one venue in a night?
So at this time when we're really trying to drive case numbers down, and we've had a bit of activity where you can probably see it's been a bit like, an analogy might be a smouldering embers. We've had these embers scattered around and what we've seen is flare-ups, and what we're trying to do is put some water or sand on those flare-ups and suppress them. And it just helps us if people are not moving around and we've got a young person who may be unknowingly out there who's infectious, because you can be infectious before you have any symptoms. And if they've gone to 4 or 5 venues in a night, then it just adds to the workload in contact tracing and just presents that greater risk that you've come in contact with a larger number of people. But obviously young people will be out and about. We just at particular times are urging, whilst we're in this higher risk period, asking young people to help us out by limiting the number of venues that they can go to. But that's the rationale for why we've asked young people to just limit the number of venues.
And should young people be giving their friends lifts or ride sharing at this time?
We know that being in close proximity in cars and having multiple people in cars increases the risk. There's some practical things we can do. And the first one is don't go out and put yourself in that environment if you've got symptoms. If you've been instructed to be isolating because the public health unit's contacted you, then don't think, oh, I'll just go out with my friends. The next sort of consideration is practically you're sometimes going to need to share a car. People need to get to work, people need to get to education. I suppose what we're trying to say is that that environment is increased risk. So some of the things that you can do is wear a mask. You can also well ventilate, so have the windows down. And if it is someone that you're normally not socialising with, so potentially interacting with a group that you're not normally hanging out with, then perhaps sitting in the back seat away from the person is probably the safest position. But this is all about applying some common sense, because if you know that you're going to go and sit next to each other in someone's house, then being in a car represents the same sort of risk. So the ride sharing advice largely relates to when there's groups that are going to be brought together that normally wouldn't be brought together. And then some of those risk mitigations are making sure that you don't, ride share in those settings when you've got symptoms, or wear a mask, or make sure you've got good hand hygiene, and also using ventilation in the car.
So do young people need to wear masks whenever they're in public?
So the advice is that masks are a fourth line of defence. And so the first one is don't go out and about when you've got symptoms, because that's when you're likely to be highly infectious, you're likely to be coughing and sneezing, you're likely to be infecting other people. The next component is very much that sort of hand hygiene and making sure you regularly wash your hands, and then socially distanced, keeping that physical distance of 1.5 where you can. When you're out and about walking around a park and you know that you'll be able to maintain your 1.5 when you're going jogging along the beach and you know that it's 4 o'clock in the morning or 5 o'clock and you're never going to run into anyone, then you should enjoy that environment. You don't need to be constrained by a mask. But if you're going out to an environment where you know it's going to be busy, you know that you're catching peak hour public transport, and even with the limitations that have been put on transport numbers, that you are likely to be in situations where you can't socially distance, wear a mask. When you're going to a supermarket, you can never tell how busy that supermarket is going to be. You know the environments you're going into where social distancing isn't able to be maintained. The thing I suppose I'd like to highlight is that indoor environments, those closed environments like on public transport, trains, buses, supermarkets, where you're actually enclosed, is a greater risk than in the outdoor environment. So I'm really focused on increasing our use of face masks, but making sure we're using them when we should be, which is when we're indoors more so and can't socially distance. And they're useful outdoors, but more in a situation where you're going to be in a very crowded space. But our other advice is try and avoid crowds as well. Don't go to those things where there's big gatherings, and there's already public health orders in place which are saying that we shouldn't gather in groups greater than 20.
So Dr. Chant, should young people carry face masks whenever they're going out, just in case?
I think that's an excellent idea, and we just suggest that you have like a Ziploc seal bag where you can actually put your face mask in, because you don't know whether, plans change, situations and environments change, so being prepared is something that would be very prudent. And also we just ask that you heed the advice around the safe management of the masks when you take them off. Wash them regularly, don't reuse the masks, and also make sure when you've got a face mask on that you're not touching the face and touching your eyes and adjusting it. So just being cautious about how you use it so you get the maximum benefit. But face masks are really important in protecting other people. And so it's not only about protecting you, it's probably more important that you're doing that to protect others. And I think it's a really important added layer of protection we can put in place.
In the media recently, we've seen young people portrayed as super spreaders. How could we change that?
I think that's a little unfair on young people, because we know very, very young people don't transmit very well, so the younger children. What we've sort of indicated is that as you increase your age, the year 11 students and year 12 students behave more like adults in their inability to transmit. But certainly consistently we've seen transmission in school settings in primary schools to be very low. So I think it's a little bit unfair, but what we know is that young people are often out and about. They're in more social settings. They have a social life, which is a really positive strength of being a young person. And so they're often in environments which might lead to the risk of transmission more, and that's why it's important to not be out and about when you've got symptoms, and just take those routine precautions. Make sure you're signing in, keeping your contact details, because if anyone at that venue is diagnosed with COVID, we can then do that contact tracing. So I don't think we want to characterise in any way that young people are super spreaders.
And Dr Chant, how does the contact tracing team determine between casual contact and close contact?
There is a guideline, which is a national guideline, which gives us some information around what would fit into a close contact. And that's based on expert views of the duration of exposure, the types of behaviours and the settings. And roughly there's things like duration of time spent with the person, whether it's an indoor setting versus an outdoor setting, the types of activities that were being conducted at the time. Based on that information and some learnings we've gathered in our response to the COVID, we've identified those who would fall into that category of the close contacts. And then because that's not 100% at getting all of the people that we've observed get infected, we also identify the venues and other casual contacts and just ask people to have increased vigilance. So it's basically a risk management approach where we identify a group that are most at risk, and that's usually based on the type of exposure, being closer or spending more duration of time in an indoor setting close to the person. And then the casual contacts are those that have had usually less duration in that event, or been further distance, or where there would have been minimal chances for crossover, say inadvertent crossover in bathrooms or other settings in the venue, rather than those that were sitting at the table or in close proximity.
In the media, we're hearing about these mystery cases of COVID-19. Could you explain to us what this means, and also if we have any of these in New South Wales?
We certainly have mystery cases in New South Wales, and we just use a different terminology. So what we call them here is locally acquired cases not linked to a known outbreak or cluster. But it just means that we haven't found a plausible reason for how that person acquired it. And what that means is that they got it from someone, we just can't find that person. And therefore there's a risk that we're missing those chains of transmission. So we're very focused on those locally acquired without linked to a cluster or a known case, because they potentially represent chains of transmission that we may not have detected. And what we're obviously fearful of is that whilst we've found this chain, there's 3 other chains that we may have not found, and that concerns us, scares us a little bit, and that's why we monitor that closely and why we place an increased emphasis on that.
As the weather warms up in New South Wales and young people want to go out and hang out with their friends more, what can we do to stay safe?
The sorts of things we would like young people to do is just not go out and about if they've got COVID symptoms. They need to stay home and get tested, even if they're missing out on something they really want to do. That's the best thing for them and their friends. We also want them to maintain that good hand hygiene, social distancing, wear a mask, particularly in those indoor environments or constrained environments. We also want people to heed the public health advice, and it's going to change. And I think we have to be honest with young people that our advice moves and changes. At the moment, we're asking young people to just sort of limit the number of venues they're going to in any one time as we're trying to bring some of these outbreaks under control. We'll be able to adjust our messaging as we gain further understanding, but this is going to be a long road ahead, so I suppose keep an ear out for our advice.
School formals and graduations have been cancelled. Could you explain to us why these new restrictions were absolutely necessary?
Over the last probably 6 weeks, we've seen, and perhaps a little longer, we've seen an increasing involvement of schools, and often some secondary schools that have been significantly impacted, which has led us to, in some cases, call the whole senior school close contacts, and have required the whole senior schools to isolate for 14 days. So we are concerned about the impact that has on our students, particularly our year 11 and 12 students as they're doing their trials and exams. So in order to keep our students as safe as possible, then again it's just a numbers game. The less interactions, the less mixing you've got, and the more protection we have of our school communities, the less chance that we've got of introducing COVID into them. And some of the guidance around perhaps not having camps and retreats is because we also know that household type encounters represent the greatest risk for COVID transmission. So the purpose is buying us a bit of time, keeping some stability for our schools, acknowledging that year 11s and 12s in particular have had a pretty tough and stressful year coping with COVID, and you'll be pleased to know that we are not cancelling these events. We're basically looking at more of a deferral, and can we get through the HSC, and can we then celebrate after that concludes in mid-November.
And currently we're not allowed to sing or play woodwind instruments if we're in a school band or a band outside of school. Could you explain the reasoning behind this?
So singing and chanting has been associated with a lot of transmission events, and what's really interesting is that the act of singing, and probably the young people who are singers listening to this will realise this better than I have, is just how the vocal cords vibrate and can generate quite fine particles, and we know that in the air they can travel quite a distance. And so that's why we've seen outbreaks in choirs, and it's amazing how far those little micro aerosols can go. So our advice is, again, at this time where we know there's community transmission, and again trying to keep schools as safe places, saying, can we just stop those choirs? We do recognise that there can be solo singers, and we've sort of given guidance for those for year 11 and 12 that may need to complete their music studies and other things. And the basis around the woodwind is just because they provide basically a straight directional. There's no loops or other breaking the air stream. So actually you're just sort of blowing out air in those instruments. So again, that possibility that you're then transmitting that is droplets and fine particles or aerosols that may then infect others. So there's guidance around the distancing that those instruments might need to be away from each other, but that's basically the sort of principle underlying those recommendations.
Dr. Chant, is it safe for us to be playing sport at the moment?
Look, sport's a really important component of young people's lives, and it keeps people healthy and active, and there's good evidence that it's good for cohesiveness and mental health. So I really support community sport. What we've just asked for at this time in terms of the community sport recommendations is that we again stop this mixing as we bring the COVID situation under control. So we just don't want large regional mixing. So for instance, whilst we know there's disease simmering away perhaps in Western Sydney and southwestern Sydney, then if we can limit the movement of those teams to other areas, you can prevent that sort of seeding. So that's the basis of our general advice. We want young people to be out there and active, but if we can minimise, again, the risks by not having that mixing between large regional areas, and also if we can limit visitor numbers. Again, it's not so much what goes on the sporting fields, but it's just around making sure the rest of the activities are COVID safe, that there's distancing of the spectators, and that if people also have to travel large distances, that they don't then all congregate in sort of shared accommodation and other settings, again, where we know COVID can be easily transmitted.
There's lots of information around at the moment about the different symptoms of COVID-19, and it can sound very similar to a cold or flu. Could you tell us how we would know to go and get tested for COVID-19 and how we would differentiate between those?
The simple answer is you can't. So this is a really very tricky disease because we know that for many the symptoms can be incredibly mild. And so most of the time prior to COVID we would have been saying you've got a bit of a runny nose, you've got a bit of a headache, you're feeling a little bit off, stay home till you get better. Do good hand hygiene. We're actually saying a different thing now, which is go and get tested. And so I can understand why young people are probably confused with the messaging. And the reason for that is we need to find those cases because the disease might be mild for you, but when you passed it on, it could be quite severe in someone who perhaps has underlying health issues or is older. You cannot differentiate between flu, some of the other viruses, and that's why it's so tricky. And what's actually interesting is we have very little flu circulating. So we've made major gains in flu through those very effective measures of physical distancing, the high vaccination rates we've got, and the good hand hygiene. We have not had a flu season. So please don't think it's flu if you've got those symptoms, and please come forward and get a test.
Can you still spread COVID-19 to people around you if you're not showing signs of any of those symptoms?
You can. Before you get symptoms, you are infectious for a period of time, around 48 hours. In some cases it can be a bit longer. You can also, there are some cases of asymptomatic, like where you don't have any symptoms. Now that's a hard category because sometimes people might have very mild symptoms when you ask them and go through how they're feeling very carefully, but they themselves are not perceiving they've got any symptoms. So we do know COVID can be spread in those settings, and that's why we need those 4 barriers. It's not just useful enough to say don't go out if you've got symptoms. We need to then assume everyone may have COVID, and that's why we need that physical distancing, the mask wearing and the good hand hygiene.
And Dr. Chant, we've discussed the issue of vaccines for COVID-19 in the last few interviews. Are you able to give us any update on where this is at?
I think to reassure young people, the world is focused on developing a vaccine. There's over 100 vaccine candidates. People are trying new ways to develop this vaccine, and the best and brightest across the world are working day and night. And also some amazing things are happening in the sense that some of the vaccines are actually being manufactured just in case they work. So approaches that are being taken to this vaccine, because there's so much recognition that the world needs a vaccine. Now, obviously, the right processes have to be gone through. So the tried and true way that we test vaccines, first in animals, then in humans in phase 1 studies, and we do phase 2 studies which show that when we give it to people they develop an immune response. And then phase 3 are the studies where we test it on a population, and where there is COVID circulating, we look at whether it provides real world defence. Those studies, each of the vaccines, are at different phase on that pathway. And then importantly, after we get a vaccine, we have to ensure that we've got what's called post-market surveillance, so that even if we've done those phase 3 studies, and even if there has been large size of people vaccinated and we have good evidence of its safety, we still routinely monitor the rollout of those vaccines and to determine that there is no other implications associated with it. So that's the usual way. Just everything at the moment is being consolidated but it is important that we take all of those steps in a methodical, careful way, because the community needs to have trust that the vaccine is effective and safe.
And finally, Dr. Chant, what are the key things that young people can do to stop the spread of COVID in their communities?
Young people can continue to go about and enjoy themselves, but just remembering those 4 key messages. And the key messages are: don't go out and about. When you've got any COVID symptoms, get tested, stay isolated. If you get contacted by public health and told that you are a close contact, please adhere to the advice that's provided about the steps you need to take, be it getting tested or isolating for the 14 days. Also maintaining that social distancing, using masks and good hand hygiene. And I think you have important roles in supporting your loved ones around you, and I just want to acknowledge the incredible resilience of young people and how it's actually been quite a hard time for young people. It's interrupted your studies, the job market and other times, and so I think I'd like to say you've got a key role in supporting your friends and your families at this time, because some of them might be having difficulties.
Thank you so much, Dr. Chant, for answering our questions today. It is important that you get your information and advice from reliable sources. If you would like more information about the virus, please visit the New South Wales Government website at www.nsw.gov.au. If you feel unwell, it is important to speak to someone and contact Health Direct or a registered GP for advice. It is normal to feel upset or concerned by COVID-19. If you feel you have been affected by the contents of this video and would like to speak with someone who can help you through these uncertain times, please contact one of the organisations appearing on screen now for free counselling and advice. Thank you so much for watching today's video, and thank you once again to Dr. Chant for her time.